Representing here with Delta. Hey, so we're still in chapter number 13, talking about psychological disorders, and I want to discuss the anxiety disorders because we all experience anxiety sometimes. But when it's really unusual or overwhelming or interfering with our life, then we might have an anxiety disorder or problem. So there's a bunch of different anxiety and anxiety-related disorders. We'll touch on a few. One is generalized anxiety disorder. That's where you have a high level of anxiety pretty much all of the time. These are people who are just constantly worried about everything in their life: finances, the weather, their family, their grades, their jobs. It's pretty overwhelming. Some people have specific phobias, specific things that they fear, whether it's spiders, balloons, the number 13. It's either an unusual fear, it interferes with their life, or it feels really overwhelming. And while there's a lot of different phobias out there, I wanted to talk about one called agoraphobia. This is for people who really have an intense fear of leaving their home, and it's probably going to continue to get worse over time. Another disorder in the anxiety realm is panic disorder. You folks probably know it better as panic attacks. Most of the time when we get nervous, we know exactly why. We've got a big test, a job interview, a first date. But for people with panic attacks, it comes out of the clear blue for no apparent reason. All of a sudden, they can't breathe and they feel very overwhelmed. They often report that it feels like what having a heart attack would feel like. They might even go to the doctor, but by the time they get there, they've usually calmed down, it's gone away, and they don't know what it is. No physical symptoms. It usually takes a couple of panic attacks before it gets accurately diagnosed. Another one, let's see, we talked about that and that. Oh, obsessive compulsive disorder. OCD features obsessions. These are thoughts that you can't shake, like fearing that you are dirty or that you forgot something. Those are obsessions. Compulsions are repeated behaviors, something you can't stop doing, like washing or counting things a certain number of times. For people with OCD, it can really feel overwhelming. Sometimes their obsessions are about being neat and clean. They're cleaning all the time, washing everything down, taking loads of showers, really long showers perhaps. And they figure that if they don't give in to that urge they have to engage in that behavior, they can't stop thinking about it. People with OCD usually know that they have a problem, but they feel like there's really not much they can do about it. It can really start to interfere with their lives. One other anxiety disorder that I wanted to touch on is post-traumatic stress disorder. After some kind of big traumatic event, like watching someone get killed or being raped or attacked, the person may have intense levels of stress to the point where it interferes with their lives. They can't concentrate, they don't want any reminders of the event, and so on. Now, again, anxiety is very common. We all experience it. But for people with any of the anxiety disorders, it gets to be overwhelming. Medications might help with some of them, but often they need therapy. They have to talk to someone. That may or may not be successful, especially with PTSD. Talking about the event, the upsetting event, usually makes things worse first before things start getting better. One other thing I wanted to briefly touch on here is suicide. I've assembled some materials. You can find them under content for this chapter. And you can also find them in your course pack, all about suicide. It is one of the 10 leading causes of death. It's really overwhelming for the person who feels suicidal and for their family that are left behind. Women are more likely to attempt it. Men are more likely to commit suicide. It's heartbreaking when someone feels so at the end of their rope that they feel like they have nothing else to resort to. So I hope you do read through some of the materials in the course pack and or under content for this chapter all about suicide. Talk to you next time.